and Caitlin Trott. Each of them will introduce themselves later during the webinar. Also assisting us is Lynn Thompson, who she'll be monitoring the chat and also helping with any technology issues that may arise. So today we're here to provide a high-level overview of the Federal Title V SRAE. We provided a lot of information in the RFP, so we don't really want to spend a lot of time going over that, but we are here again to make sure we answer any questions or clarify any information that's there. So we'll be talking a little bit about Minnesota's Healthy Teen Initiative. And also, most importantly, we're here to answer questions that you may have. So we want to provide that opportunity for you to have some in-person time with us. And before we go further, we'd like to address a few little housekeeping. We're asking for those of you who've called in, if you would please mute your phone line, or and this is an interactive webinar, which means that your line may be unmuted or open during the entire webinar. Just a reminder to be respectful of others on the call. If a lot of us are working from home, and I know every now and then, we can hear other things or other calls. So just be aware of that. We are recording the webinar and we will post it on the RFP webpage. And for any questions that you have during the webinar, just feel free to put those in the chat box. So the title of the Sexual Risk Avoidance Education, or SRAE. The grant program is funded by the Family and Youth Services Bureau of the Administration for Children, Youth, and Family Services. The program funds states and territories to implement education exclusively on sexual risk avoidance that teaches participants to voluntarily refrain from sexual activity and other risky behaviors, and to provide education to youth that normalizes their optimal health behavior of avoiding non-marital sexual activity. It is also designed to teach the youth personal responsibility, self-regulation, goal settings, a focus on the future, and the prevention of risk behaviors such as drug and alcohol use without normalizing teen sexual activity. The mission of the Federal Youth Services Bureau is to support organizations and communities that work every day to end youth homelessness, adolescent pregnancy, and domestic violence. The vision is to have a future where all youth, the nation's youth, individuals, and families, no matter the challenges they face, can live healthy, productive, violence-free lives. And so this program serves disproportionately impacted youth between the ages of 10 and 19, including youth who live in under-resourced regions, areas with high rates of teen births and STIs, culturally underrepresented youth populations, youth in adjudication systems, youth in foster care or aging out of foster care, victims of trafficking and runaway youth, and youth experiencing homelessness. State selected, so projects are implemented using a positive youth development, or a PYD framework, as part of the risk behaviors, as part of risk avoidance strategies to help participants develop healthy lifestyles, healthy life skills, increase their individual protective factors that reduce risk, make healthy decisions, engage in healthy relationships, set goals that lead to self-sufficiency and marriage before engaging in sexual activities. The projects are implemented. The states also use SRE funding to fund partnerships with community partners to educate youth on the optimal health, the behavior of avoiding non-marital sexual activity and other risk behavior. State-selected interventions and our strategies, they must be medically accurate and complete, age appropriate with regard to the developmental stage of the intended audience or the youth that are participating in the programs, culturally appropriate, recognizing the experiences of youth from diverse communities, backgrounds, and experiences. Minnesota Title V SRAE funding is federally funded and administered through the Family and Youth Services Bureau. And federal fiscal year, we received over $692,000 in federal state Title V SRAE funds to support the Healthy Teen Initiative. And our Healthy Teen Initiative purpose is to decrease risk factors and increase protective factors associated with teen pregnancy and sexually transmitted infections for Minnesota's most vulnerable youth. So while our main goals are to reduce teen pregnancy and STIs among our youth. And like the federal SRAE program, the HIT grantees teach programs that teach our youth self-regulation, healthy decision-making, and a focus on their future, and preventing the risk of health risk behaviors such as drug and alcohol use without normalizing teen activities. Minnesota Teen Healthy Initiative targets its SRE funding to reach population experiencing the greatest disparities in teen pregnancies and STIs through implementation of high quality, medically accurate, evidence-based, and informed programs to promote healthy youth development, abstinence, risk avoidance, and to delay the onset of sexual activity in youth 10 through 14. In addition, we implement evidence-informed programs that reach parents of youth and adult mentors that interact and or work with youth ages 10 to 19. Excuse me. Mouth getting very dry, sorry. So this RFP, this is a competitive grant, and the applicants select are awarded or may apply for funding between $60,000 and up to $170,000 for each year of this grant. The base amount is $60,000, and so we'll go up to $175,000 is what we're expecting with the funding that we have. We're currently at the end of a 5-year grant cycle that it ends September 30th of 2023. MDH only allows us to award grants for 2 consecutive years with an option to extend an additional 3 years. And so this RFP, we're asking that you develop your work plans, submit work plans and budgets for these 2-year periods. So the first year is from October 1 through September 30th, and I see a big glaring typo, but it ends in 2024, and year 2 is from October 1 to September 30, which is the federal fiscal year. Our eligibility, so this grant also is for nonprofit and 501c3 organizations, including community-based organization, youth-serving organization, faith-based, tribal governments, local governments, community health boards, school districts, and schools, as well as alternative learning centers. And again, our targeted populations are for youth with the highest rate of teen pregnancies and STIs, and youth living in under-resourced regions, for example, rural Minnesota, culturally underrepresented youth, people of color, and American Indians. Again, youth in or aging out of foster care, LGBTQ youth, youth in schools, after school settings, and also youth that are in justice-involved systems. We also serve through our grants parents or adult mentors of youth ages 10 through 19. Some of the program requirements is to implement the curriculum with fidelity. And we have a list of approved MDH curricula, but there are others, and we'll talk about that a little bit later. Participate in all MDH required trainings, submit quarterly invoices, submit quarterly and semi-annually reports, You're required to participate in required evaluation and related reporting activities, and then to comply with MDH and the federal requirements. So the application requirements, and they are outlined in the RFP, is the short line survey and the grant application phase sheet. As you begin to complete that short line, well, after you complete the short line survey, you'll see that the grant application phase sheet is the same. However, you still do need to complete that. The online survey does not come, it goes somewhere else to our grant agreement liaison person. And so it's a different, it's used for a different purpose. And so we don't get it. And so if you look and say, oh, I just completed that, you do need to complete the application online, the grant, the both of those phase sheets. The narrative sections need to be completed in 12-point font, a 1-inch margin, single space, a maximum of 7 pages. And as you can see in the RFP, it has the page limit for each, but it is a total of 17 pages. You have to include the work plan, and it needs to include the curricula that you intend to implement, what the goals are, long-term and short goals, and the budget justification. And these are all forms that are in the RFP, and each one must be completed. The budget justification, as well as the budget justification summary, the indirect cost questionnaire, and this is required for CHBs, but others may also request that if you have that. The applicant conflict of interest disclosure, all applicants must complete that and certify that. The due diligence review is required for everyone except community health boards, and the SRAE medical accuracy certification, if that's appropriate. Now I'll turn it over to Jill.
Thanks, Judy. I'm wondering if y'all are planning on just advancing my slides, or if you'd like me to share my screen.
I can advance this. I have it up. Just
Wonderful.
let me
know. Okay, perfect. Hi, everybody. Welcome. My name is Jill Ferris. I use she, her pronouns. I'm the Director of Adolescent Sexual Health Training and Education at the University of Minnesota at the Healthy Youth Development Prevention Research Center. And our Prevention Research Center is the contracted TA and training provider for all of the SRAE grantees. And so therefore I am listed on the screen as the curricula training contractor, and that's the role I play on this project. And I'm going to talk a little bit more about some of the curricula that you are allowed to write your application to use. So I'll ask you to go to the next slide, please. So as you can see here, we have several different choices for you. There's one more slide actually that has some more, but these curricula on the screen are curricula that are specifically for middle school aged youth. And I think most folks on this call probably know that abstinence-focused curricula are typically more sort of more appropriate for young people sort of in the middle school ages. So there's 4 curricula on this screen, and I'm going to talk about each of them in a little bit more detail, but you can see that the ages of these are, again, kind of this 11 to 14. Okay, next slide is fine. Perfect. Oh, and then perfect. So then there are a couple of different other programs that have a sort of a larger age range, or they target a different group. So let me talk about these. So the Live It program and the Teen Outreach program, both of which are intended for kind of wider age ranges, and I'll talk about those when I get to those slides. And then the last one listed on the slide is not a curriculum that is targeting young people, but is actually targeting parents of young people. So that is a little bit of a different approach than some of the other curricula, and I will talk about that when we get there. Next slide, please. Okay, so the first curricula that folks are allowed to use under this funding stream is called Project AIM. It stands for Adult Identity Mentoring Program. Project AIM is a youth development-based intervention, and it is, as it says here on the screen, really intended for any target population. Some of these have very specific groups that they were maybe researched with or that they are targeted toward. Project AIM is not one of those. It's a pretty general reach in terms of who can be targeted with this intervention. The age is middle school, so 11 to 14. It's intended to be done in community-based settings, and it can also be done in schools. There are 12 50-minute sessions that are delivered twice a week over 6 weeks. So it's a pretty specific replication sort of model for this curriculum. And this curriculum, I'm actually wondering, I think there might be a tiny typo in the URL there. There's like a weird bracket before the words Project AIM. So I'm guessing if you take that out, that the link will work. But you can see here that there's a Children's Hospital of Los Angeles is the URL there. And so they're actually the people that own the program and replicate it. So it costs, there's a $2,000 annual fee to be a replication partner with the Children's Hospital of Los Angeles. And then they actually do all the training for this curricula. The University of Minnesota has not been able, or the state of Minnesota really has not been able to agree on a replication and a training process with them. So if folks would apply to do Project AIM, you would work directly with the Children's Hospital of Los Angeles folks around training. And you can see there that the training fees you would need to budget are per person, and they're $1,210 per person. Next slide. So Health Smart is the next program that people can use with this funding stream. This is considered an evidence-informed curricula. So it's not evidence-based, but it is evidence-informed. It is aligned with the National Sex Education Standards and the National Health Education Standards. And it focuses on the CDC's 6 areas of risk for young people. So this curriculum is through ETR. You can go to ETR's website and look for Health Smart and find more information about it there. As it says on the screen, it is for middle schoolers. It is also for community-based and school settings. It can be targeted to anyone. There are 16 lessons with this curriculum, so it's a little bit longer than some of the other ones that we have available. The lessons are between 45 and 60 minutes. The cost for this one is a little bit more reasonable. It's $55 per instructor, and that just means that each instructor would have a login and have access to materials on the Health Smart website. And then there's a per student charge, and that's mostly for workbooks and other materials that young people would need with this curriculum. So Health Smart is one of our options for the middle school audience. Next slide. Making a Difference is another curricula that is, again, based on really a middle school audience. Making a Difference is one that has been used quite a bit in Minnesota in the past. It is really really focused in on reducing risk of STI, HIV, and pregnancy, and focused on helping young people wait to have sex or decide that they're not going to have sex if they're already having sex. It is really designed for middle school youth, so it should really be used with that kind of younger age group. There are 8 60-minute lessons with this curriculum. There's also a 13 module school edition that has 40-minute or 45-minute lessons. And again, that's just intended to so that it's just easier to implement it during sort of a school-based, like a school day or a school-based lesson. And the cost of this curriculum is not insignificant. It's about $1,000 to order the curriculum. It includes some videos, and it also includes some student workbooks. So you definitely want to budget for this one. And then you can see there at the bottom that this one's also from ETR. Lots of these curricula are owned by ETR. So ETR is the website where you can learn more about Making a Difference. Next slide. So Promoting Health Among Teens is actually really similar to Making a Difference. They're actually written by the same author, and they're kind of based on the same model and the same curricula. But this one just has a little bit of a different focus, and was created a little bit later than Making a Difference was. So it just has a few different activities and things. But it's really also focused on knowledge, attitudes, and skills, and helping young people implement not having sex into their relationships and into the conversations that they're having. So again, this is also for middle school. It's 8 60-minute lessons, and similar to some of the other ones, there are school-based editions of this that you can purchase that are longer in terms of modules, but they're shorter in terms of time to accommodate school-based schedules. So this one's also $1,000, and you can see that the website is there in terms of ETR. And don't get it confused with, there's a Promoting Health Among Teens comprehensive version. So when the research was done on this curricula, they actually had 3 treatment arms, an abstinence curriculum, a comprehensive one, and then like a control group. And so that's how we got this promoting health among teens abstinence only version on our list. So make sure that you're looking at the abstinence version if you're on NTR's website. Next slide, please. Okay, so we're moving on to Live It, and this curriculum is for a little bit larger of an age range than the ones I've been mentioning previously. So Live It is a program that's actually developed and designed here locally in Minnesota. It was developed by the Division of Indian Work, which is in Minneapolis, and it's designed by American Indian people for American Indian people. So it's a culturally specific program. It really, as it says on the screen, really targets social and emotional development. There's a lot of cultural exercises, artistic, self-reflective exercises. There's a lot of information in here about sort of culture and sort of customs and elders and cultural pride. It's intended to be delivered to American Indian youth. It can be delivered to youth that are not Native, but it is certainly a program that is intended to be for young people who identify as Indigenous. It is a larger age range, as you can see, 11 to 18. With this curricula, like other curricula that have a larger age range, you would want to make sure that even though that age range is really big, that you were proposing to implement this with groups of young people that are similar in age. So if you were to use Live It, you'd want to say we're going to target high schoolers and they'll be 16 to 18, for example. You wouldn't want to have an 11-year-old and a 17-year-old in the same cohort. This curriculum is done in community-based settings. There are 10 lessons, each between 1 and 2 hours, depending on the lesson. The Division of Indian Work is the training sponsor and the host for this. And so if you want more information about the cost and kind of how the structure of this works, you can reach out to the Division of Indian Work at the website below. Next slide, please. Teen Outreach Program is one of the other programs that we have that is for kind of, again, a wider age range. So the Teen Outreach Program is a youth development focused program. This can be targeted towards any group of young people. The age range is wide, and just like Live It, we would ask folks to sort of the best practice in terms of implementation here would be to implement with similar ages and age cohorts of young people. So 12, 13, 14, for example, and 16, 17, 18, for example, would be a strong sort of cohort in terms of this program. The biggest, I think, kind of hallmark of the Teen Outreach Program is the community service learning that the curriculum employs. So the curriculum is, there are 25 weekly meetings, and there's a lot of flexibility in terms of what those weekly meetings look like. There is a curriculum that goes along with the top program. And as you can see on the screen, it's focused on key topics that are around social, emotional, and life skills, developing a positive sense of self, and connecting with others. There's about 140 lessons in all of the different top curriculum materials. So that does give facilitators a lot of leeway and a lot of latitude to choose what lessons they want to use, depending on what their young people are lifting up as important and as salient to them. And then alongside those weekly meetings, young people need to complete 20 hours of community service learning. And that doesn't have to be in the community. It needs to be serving a community, and that community can look a lot of different ways. I do want to mention that there are semester adaptations of TOP that are allowed. I think one of the things that sometimes throws people off with TOP is just how long and intensive it is in terms of a whole year-long 9-month implementation. Folks are allowed to do kind of a half dose of TOP, if you will. So 12 weekly meetings and 10 hours of community service. That's an allowable adaptation. You would just need to let us know that you're doing that. We'll clear it with the curriculum developers, and then we're good to go. The cost for this curriculum is $595, and this curriculum is owned by Wyman, which is in St. Louis. So you can see the URL at the bottom there is at Wyman Center. They're the ones that are the replicators of TOP. And so if you would want to do TOP, you would go through us to do that, but Wyman is the owner. So that's why you're seeing Wyman there. Next slide, please. Okay, so this is It's That Easy, which is about a curriculum that is targeting parents. So this curriculum is really kind of different from a lot of the others in that it is targeting, it's training parent educators. That's sort of how we think about it. So folks that work with parents in a variety of different settings to equip parents to have open and honest conversations with the young people in their lives. So it's equipping the parent educators, the folks that are doing this work, with practical tools and strategies for engaging with parents. And it's empowering parents to connect with their kids, to share what their values are as a family and as a community, and to engage in meaningful conversation. So the target is parents. And the Minnesota State Adolescent Health Coordinator is actually the person who you would want to get in contact with. There are usually a few kind of cohorts of this training going every year. And so you would just get in touch with the Minnesota Department of Health at that address there, and they would just hook you in with already existing trainings that are happening on the state level. Next slide. I think that might be my last slide. Yes, perfect. So there's my contact information. Feel very free, of course, to reach out to me, but to ask any questions that you have. I don't know if we're doing that now or at the end of the webinar, but I'll be here to answer questions about curricula if you have them. And I will turn it to Caitlin.
Thanks, Jill. My name is Caitlin Traub, and I'm an adolescent health epidemiologist at MDH, and I'm also working as the evaluator on the Title V SRAE grant. So I'm going to give a brief overview of the evaluation requirements for this grant. As indicated in the RFP, an evaluation is required for the Title V SRAE grant. Grantees are required to indicate process evaluation items in their work plan, and grantees will also be required to participate in a national evaluation effort with federally mandated performance measures. So please make sure to read those requirements as outlined in the RFP. The evaluation element of the Title V SRAE grant includes standardized procedures to monitor and assess local project accomplishments relative to the objectives and work plan of each grantee. And Title V SRAE grantees will be required to report federally mandated performance measures, as well as process evaluation measures to MDH staff at regular intervals. Data collection and reporting will include elements such as student entry and exit surveys, those federally specified performance measures, and program fidelity measures. And these requirements will be made available to grantees who are selected. MDH evaluation staff will work with grantees to plan the implementation and evaluation of all Title V SRAE projects. And grantees will need to identify 1 or 2 staff who will work with MDH evaluation staff to plan, collect, and report on performance measures. Grantee evaluation staff will be required to work with the MDH evaluation staff on specific items, which include training sessions for data collection and reporting. MDH evaluation staff is here to provide technical assistance throughout the evaluation process. And we will also encourage grantees to use the data collected through these evaluation requirements to inform their own local programming. Next slide, please. Due to the potential sensitive nature of the data collected for the evaluation, grantees are required to submit an evaluation plan to an IRB, or Institutional Review Board. This could be through their own organization's IRB or through MDH's Institutional Review Board. And MDH evaluation staff can help support grantees through the IRB process. Grantees are responsible for completing any approval process that is necessary to implement programming and evaluations within their designated settings. For example, many schools require approval for the administration of entry and exit surveys. And once again, MDH evaluation staff is available to support grantees with this. The Title V SRAE grant will also require parental consent to be collected and participant assent to complete the student surveys. Finally, applicants must agree to complete all requirements above for the purposes of this request for proposal. If there are any questions, feel free to ask now. And if not, we can please add them to the chat and we'll address them afterwards.
So Lynn, are there any questions in the chat? Does anyone on the call have any questions for either of us or all of us?
There weren't any in the chat, but there was one, but Jill had answered that.
Oh, okay.
There is one question from Shauna. She asks, is it okay to do an opt-out parent letter?
Yes. Yep. Good question.
I was looking up a little bit of the information about positive potential just because I know our friends from Waukegan County are here and wondering about that. So I would say that in order for this curriculum to be one of the one, I mean, like, so the answer is yes. As I said there, I kind of copied the language that I wanted you to know about that. The curriculum, the way it was evaluated was a 19 session randomized control trial. So it was 15 classes and 4 assemblies in middle school. So I just want to be sure that that is what you all would be applying to do, because again, the idea here would be that you would not be like picking and choosing. So I know there's like a 6th, a 7th, and 8th, and there's different levels and different lessons. You would need to follow the same kind of structure that the researchers did when they got the outcomes that they got. So I know that that's a heavy lift in terms of 19 sessions, but if that's something that you all are prepared to, implement there, then absolutely write it up that way, and reviewers will consider it that way. Hope that makes sense.
Are there other questions?
Yeah, Sean, I see your
Congressman.
question. Yes, I think that is the way that it was evaluated. And if we are, I mean, that's what I think that would be. And I mean, I'm sorry if I'm overstepping, MDH people, please step in from a programmatic angle and tell me. But I think, all these curricula are evidence-based or evidence-informed sort of in their entirety. And that's what the goal here. And so we would want you all to implement it in the way that it was researched to be effective, which would mean all 3 levels. Yep. And I know that that's maybe not what's happening right now, because I think what happened last time is that you all kind of asked about this sort of mid-grant stream and got an answer, and you've been doing it a certain way. And I think that's not necessarily I don't think I have exactly the same answer as the way that you're doing it now, if I understand how you're doing it now.
So that's really good to know. Thank you. Yeah, that definitely will change what we do when we're writing this new grant. So thank you, Joe.
You're welcome.
I'm sorry, I was totally not clear what she was asking.
I know
Thank
what
you,
she
Jill.
meant. All these acronyms, they don't mean the same thing to all people, right? So yeah, I gotcha.
Are there other questions? Anything about any of the requirements other than the curriculum? Well, again, I wasn't sure how long to schedule this webinar, but if people in the call, no one has any further questions, like I said, we can give everyone an hour and a half back. But and again, if you guys do have any other, do you need to create your own evaluation?
No, you would not need a full evaluation plan. There is a requirement in the work plan that you have process evaluation indicators that you're reporting, and my understanding, and Judy can correct me if I'm wrong, you would indicate those process evaluation indicators, but the statewide and national evaluation are already set, that you don't need to create that evaluation.
And again, Susan, the evaluation is really about your process in terms of how are you putting your program together, how are you going to implement it, and those are things that you're going to be putting in that work plan. And when you're doing your reporting, you're also more or less will be kind of talking about the challenges and accomplishments or whatever challenges, barriers you had in implementing. It's like, did you implement the curriculum that you selected? Were you able to have the number of participants? But if not, then those are the things that you're going to kind of look at what your process is and rethink those. Okay, again, if you guys, and once you start working on your the RFP on the application, if there are questions, there is a question and answer. There's a link, an email address that you guys can direct those to. And we actually post some. It's a little delay. I know I said within 2 working days. It might be a little longer because we have to request that they be posted. And so it's going to be based on the availability of the staff. But we have posted the questions that we've received so far. They are online. So if no one has any further questions, I guess we will say goodbye and enjoy the rest of your afternoon. And thank you.
Thanks, everybody.
Thank you.